Thank you so much. It's an honor to share this time with so high quality professionals and friends as Cynthia and David, who are we are in the same boat, defending podiatry not only in the European level, also in the international abroad of the world. Then can you see my screen, please?
Yes, we can. And if you open in slide, great.
Okay. Then probably my presentation is not so clinical that my colleagues and my friends, but let's try to show what is the situation, the actual situation of podiatry in Europe, and obviously Romania is involved in this situation. And the main aim of my presentation is to get hope to podiatry in Romania, because there's a very positive factors that goes in that direction. Firstly, I would like to explain just a little what is European Council of Podiatrists. That is a committee of International Federation of Podiatrists that the main goal is defending and promoting the podiatry along Europe. And actually, there's the pictures, the very friendly pictures of the different members of the ECP. And this is the first important point here, because actually you have one member, is Norina Galban from Romania. This is the tireless woman who is the most important person defending podiatry, not only in Romania, is also around the world. And as you can see, we have the representation of the different countries as Spain, mine, Netherlands, Belgium, Malta, Romania, and France. You know, Cynthia, who talked before, also involved in this project. Referring to the educational situation in Europe, as you can see this slide, you can realize the difference between the educational programs that exist. In red, there are countries in which the podiatry doesn't exist yet, or they have no recognition of the profession. Also, you can see in orange the podiatry that is lower than baccalaureate level. In blue, the countries who has the podiatry in baccalaureate level. And then finally, just a few countries who has the master level podiatry, mainly in UK, Ireland, Portugal, Spain, and Malta. And probably we have the responsibility to support all countries to achieve the best educational program level, and also the highest competencies levels as well. Just as a curiosity, is if we take a close look of the different educational development of the different countries of Europe, we can see that, for example, at the moment that we can cover the information in this issue, we can see, for example, the Czech Republic, that the podiatry, as we understand, was covered by as a name was podiatric nurse. Also, you can see in Belgium or Denmark the differences between the time that the student has spent to be a podiatrist in different years, 3 years full time, or just 18 months. No, it's quite different in this podiatry education system. Also, fortunately, Greece evolved to baccalaureate level, but at the moment that we create these tables, they were only recognized as nail technicians. This is a really strange name for a podiatrist also. And if we take a look at Poland, at that moment, there's mostly cosmetic schools with podology departments, no? But the evolving educational programs in Europe allows us to get the best educational programs in our universities, as Spain in 4 years for 240 ECTS, in order to design the curricula of the school, and also United Kingdom, for example, in which they spent also many years to get the master level. But here, if I am right, there's a little difference within the countries. As you can see, all of Europe is very different in the achievement of the podiatry or the podiatrist as a professional. That's why we need to realize also that so many names needs to be grouped in just one name, and we need to take just the name of podiatrist as a professional who take care of the feet of our patients. And this podiatry is not just the name. The name of podiatrist means that they involve the bachelor level. They involve competencies level in order to unify the criteria to get the same professional everywhere in Europe. Then this is the definition of podiatry that we made from the ECP, and this is the definition with the little changes that the International Association adapts. And we can define podiatry as that professional of health science concerned with research, prevention, diagnosis, and treatment of deformities, pathologies, and injuries of the foot and associated structures in relation with the body, as well as the manifestation of systemic disease, by all appropriate systems and technologies using a scientific and professional specialized knowledge. I think it's really good definition because, as you can see, podiatry is not just take care, it's much more. Is prevention, especially when we talk about diabetic or all complications produced by COVID-19, for example, and the promotion, also the research, always in benefit of not only profession in our patients. This part is just to show and get a hope for those countries that they have no still no have yet the podiatry in developed or recognized. Two samples: Spain, that spent a lot of years and evolving from just a little school from 1955 to nowadays, in which we have the highest level of competencies of professional development. I think it's Spain. It's made a good step in research, for example, and in surgery, and the educational programs is really common in all over universities. But also, we have been supported by the different laws that allows us to get the diagnosis, for example, or the prescription of drugs. But also the third level is how can we organize our own professional structure in the different regions. I don't want to be a boring speech, but just show how the laws of the evolution of the educational overlaps and needs to go together in order to develop that profession. Here, the academic legislation allows us from since the creation of a school in which we were just 2 years as a specialization of nursing, and now a degree of 4 years with all competencies, passing through all the different structures and creating and transformation of the clinical podiatric of University of Barcelona, for example, to a pediatric hospital. I think that's a really important steps in order to push up our profession. Also, the professional legislation ranges from the be able to be as directors of X-ray facilities or prescriptors of the different orthopedic devices, or be recognized by law as a health profession with all the rights that it means. And also the most important law that supports us is about the prescription, because just 4 professions can prescribe drugs. You know, that is the physicians, the veterinaries, podiatrists, and dentistry and dentists. They are the 4th profession that in their own field that can prescribe this drug. This is a really big step for us. And the last slide related this evolve is Portugal, because Portugal is a really amazing example, because in the podiatry didn't exist also until they decided to create the first school in the north of Portugal, and then contact with the University of Barcelona to create a helping group to teach there. And they took a really short period of time comparing with Spain, in which they created the school, created the profession, was supported for the law. They have the title recognized, and also they have a master level recognized as well. And here the question is why Portugal could do this great evolution. It was mainly by 2 things. First one is getting the tireless people defending and fighting and loving to create podiatry. Romania has it. And also because at that moment, one of the responsible persons of the school was a parliamentary person, and it was a really help to develop the podiatry there. Now the satisfaction for us is the most of the lecturers at that university were our students, and we saw the terrific evolution of podiatry in Portugal. And sometimes politics works in a good direction. And as in the rest of Spain, also in different regions, shift agreements. I just show you an agreement of the Catalan Podiatric Board, who get a good deal with Catalan Health Council, and in which in this agreement they organize a training course in which some podiatrists were authorized to get in their own office 3 visits a year for every diabetic patients, to charging to the public health system these visits. And this is a really important step for diabetic patients, because by this deal, every patient can at least be controlled every 4 months a year. That has been a nice action, because we had really good outcomes, as less infections and amputations, better control of systemic complications, because we are working as a multidisciplinary team, and we have a really close relationship with the general practitioners and nurses, and also we can refer directly to the hospitals to do the X-ray control of osteomyelitis, for example. And also we help a lot to lessen the workload that in primary care units are having at the time. But well, in Romania, it's a really amazing country, because they also has already an association of podiatry. It's very important step for all professions in Romania. As you can read in the slides, they defend the profession of podiatry. Then this association is the first step that every country had to start to develop the podiatry. But I think that Romania has, as Portugal, the best position possible, because it's a country that can start podiatry from the experience of the rest of the countries that already has the podiatry. And the most important factors that Romania has in podiatry is Romania has a tireless person to defend podiatry, as Dr. Norina Galvan, that's founder and honorary president of Asociatia of Podiatry. Also, another important step for podiatry in Romania was the including of podiatrists of health specialists unclassified in the law. Also, the important universities of medicine and pharmacy of Cluj and Timișoara have submitted a curricula of 2 years of master in podiatry. That is very important. As you can see, probably every country take their own way to develop a profession. I think it's quite good to start quite difference in referring on other countries. And also another important thing is that Romania has the support, as you can see with the amazing professionals that are participating in this conference. Romania has the support of international institutions, specialists, and academics. And especially this amazing relationship produces some of the better actions, as the designing of the master in podiatry that were with the collaboration of our friends Cynthia Formosa and Alfred Gatt, and was this structure of this 2 years master, in order to see how important is the covering all the areas in which podiatry are developing their own their field. No? Then this all that I want to talk about this. I think that Romania it's the next country that probably will improve the podiatry in benefit of the population. I think that Romanian people needs and deserves the best attention of their feet, and I think that's there's a lot of professionals who are desiring to work also in Romania, because one of the actions also I know is to get professionals, podiatrists abroad that can collaborate in the development of podiatry in Romania. Thank you so much. I love this picture, because it means for me that everyone works for podiatry in the same direction to get the better results and the better level possible. Thank you so much.